Good evening, ladies and gentlemen, and welcome back to SF Commons. Tonight, we have invited back Beverly Wasserman, a registered nurse from Colorado, to again give us a glimmer, an explanation, and to point us in the right direction as to what is really going on with our healthcare today. The mainstream media has talked about Obamacare and has talked about the efforts right now being made in Congress to revise, to change Obamacare. We have, during the presidential season, now President Trump, Bernie Sanders, and Hillary Clinton talk about the need to ensure that the American people have health care and that health care is a right. Tonight we have again Beverly Wasserman, and just kind of want to give you an idea of who she is and how lucky we are to have her. Beverly Wasserman is a registered nurse from Colorado. She has been a practicing nurse for 30 years and has done so in public health. She is a graduate of the Regional Institute for Health and Environmental Leadership, and she continues to provide leadership coaching to executive level physicians. Beverly is a Latimer County nurse leader with Nurses Colorado Care. Welcome, Beverly. Hi, how are you?
I'm good. Thank you for inviting me.
Oh, we're so fortunate because last time we had to improvise and get you on the telephone because we didn't have audio. So now everything, all the technical
Yeah.
problems have been fixed. So anyway, Beverly has prepared this incredible PowerPoint, which she will guide us through because the whole idea behind the type of shows we're doing is to be an education to the public, that it be an educational process, that professionals like Beverly tell us, the truth, what is really going on with healthcare based, on her experiences as a professional, a healthcare provider, and somebody who really knows public policy in healthcare. So, welcome again, Beverly. So it's nice to be back. So, do you want to get going with your PowerPoint, or do you want to give us a little bit of a background, kind of where are we today with healthcare?
Well, I guess I could start with a brief kind of background, and I think it's very appropriate that Colorado and California,
Right.
really, you and I talking today, are having this discussion
Uh huh.
because both of our states have really started to examine a single payer system that would make sure all of our state residents were covered. We'd like to see that nationally,
Right.
but as we can see, we have a lot of just some areas we need more alignment on at the federal level.
Right.
So what I'll talk about a little bit with the slides today are kind of some of the challenges we're seeing with the current proposal that's being presented.
Right. The first thing on the slide would be the missed opportunity. Where is the promised health finance reform?
Okay, so this snapshot is really from Kaiser. They did a wonderful job of laying out, and if you look online, they actually have, you can go into your state and look at what the cost of the tax, whether you're going to get tax benefits or more
Right.
taxes with the new plan. But the bottom line is most Americans, this is across party lines, agree that we're going the wrong direction.
Right.
We're also not moving toward reform. This is a complicated picture that I definitely can't discuss in 20 minutes.
Right.
But the bottom line is we were looking, if we're going to reform our federal level financing for healthcare, we
Right.
want improvement. And we definitely didn't want to take health services away from those who can't afford to pay for it, from mental health, to cut public health budget. I mean, there's a lot of cuts being made, I would say, in the wrong areas.
Yes.
That's my
Your slides show that we are on the wrong track. How about okay? So you had talked about the waste, that $750 billion are wasted annually. Could you elaborate on that?
Yeah, now move to our next slide.
Right,
Uh, for starters, we pay a lot of money in, especially over the past, since really 1990,
right,
between 1990 and 2010, we suddenly spent all this money on administrative cost. That has nothing to do with the delivery of health services. And that has grown at a rate that's unsustainable. We won't be able to keep up with this over time if we
right.
continue to fund all this money into administration. Not to say we don't need administrative services, but we don't need to be paying such high tickets to, for example, to the CEO of an insurance company.
Right.
That, this is a capitalist country, and they're able to make money, but I think they've taken advantage of.
You're talking about 3,000% increase.
Yes, yeah.
Right.
I mean,
From.
it's unsustainable.
Right.
So,
Exactly.
and none of our current plans are addressing this.
Yeah.
This
You have here $750 billion are wasted
right. And
on
let's
healthcare.
move to the next slide.
Right.
And if you look at where the waste is happening,
Right.
it's across. So there's different areas we could work on. Some of it is insurance and bureaucratic costs, but if you look at the top, some of it is unnecessary services. So there's a lot of things we could do inside the healthcare system to cut cost, but we shouldn't be cutting services to our patients.
Exactly.
So
Exactly.
so there's plenty of work to be done. And if you move to the next slide,
Yeah. What's wrong with this picture? Yeah.
we look at how we compare around the world. We pay more for our healthcare, and it's not that we're getting more services. We do have a wonderful scientific community in the United States, and I think we're at the top of science with regard to some of our discoveries and
Right.
research, all of that, which is great. But we shouldn't be spending so much and providing, at a lower rate than other countries that spend less money. Our costs have just gotten out of control,
Right.
and that's a problem we're not addressing in any of the
So
federal
in terms of
plans.
overall healthcare ranking, we rank like number 11
Right,
in terms of the quality of healthcare we're providing, but then we spend more.
right. Than any socialized.
Exactly, exactly.
So these are just examples of challenges we have that we haven't addressed, and we still haven't addressed.
Right. So
Uh,
you're talking about the Obamacare now on the slide, and you
mhm.
have here, don't throw out the baby with the bathwater. And here you presented the essential services of the Affordable Care Act, and that 18 million people will lose health insurance. So if it's repealed without a replacement, so can you elaborate on this?
Yeah, so right now, these services that I describe on the left side of that slide they are standards of care. They're services that if we don't find a way to pay for them economically, meaning we fund it as a group, as a national effort,
Right.
then all of that, people not having insurance or coverage will filter into our emergency rooms.
Right.
They will. People that need care will seek it out. And ER care is the most expensive way you can deliver services. We've learned that lesson already, 30 years ago. So it just is going to take us back if we don't provide these essential services. And that was key with Obamacare. It wasn't perfect, but it did provide essential services, and it really provided service for the poorest in our population.
Right. On the 18 million and the 32 million, could you elaborate on that? Because a lot of um, the folks who are in state-sponsored Medicaid programs, they are
Mhm.
part of this Obamacare calculation, right?
Yes, definitely.
Right.
I
Okay.
mean, what Obamacare did around Medicaid, because it is, like you said, a state program, it expanded in other words, people, there was a really strict limit. I forget the amount of poverty level, but people could have a family of four and make, you know, $25,000 and
Right.
still might not qualify.
Right.
With the ACA, suddenly more people could qualify for Medicaid and get
Right.
insurance.
Right.
Who we would know, any way you look at it, you would call these folks low income.
Right.
They have a budget to cover health insurance.
Right.
So that is the difference. And if we start to pull back that coverage,
Right.
that puts that population back out there with no health coverage. And that means number one, they'll wait till they're sick before they show up to see a doctor.
Right.
And they do it through an emergency room.
And that's the concern that the American Nurses Association has, right? So, here
Exactly.
you're talking about the millions of nurses speaking out.
Right. Well, I mean, from a nursing perspective, definitely, we're also, when we take money from public health,
Yeah.
we're the ones that prevent, epidemics from turning into pandemics.
Right.
Most people don't know the work that's done behind the scenes to keep the public safe. That is our mission in public health. So when we start to cut essential, again, just like the ACA coverage, we're cutting essential services. We're not saying, we know we have to do something with the budget, but those are not the places to cut.
Right, exactly.
Okay.
So then, you mentioned here in your slide presentation about the GOP healthcare plan,
Mm-hmm.
and that medical hospital groups oppose that. So, could you elaborate on this a little bit?
So not only does the American Nurses Association, take issue with the current proposal, so does the American Medical Association. The other challenge that is noted by the hospital groups and the AMA is that no one came to the experts in the country who deliver health services and ask us, how should we do this? What's the best way? We know we have to cut budget, but what's the best way to do this?
Right.
They didn't ask, no one's been consulted about this plan, and I just don't know where the ideas came from, and obviously is from, politicians who they couldn't work in healthcare and have rolled out this proposal that they have
Right.
currently.
And so you're talking about, the GO plan right now is still it needs a lot of work.
Yes.
Because it raises premium for the older folks, and it rolls back the Medicaid expansion.
Mm-hmm.
So those are the two major policy issues.
Yes, and cutting mental health services. We already don't have enough funding for mental health services nationally. And there's such fallout from that. We end up with people in jail who shouldn't be in jail. They need mental health service. And we pay the cost for jail. I mean, so it's just a big snowball when we don't deal with the root causes.
What happens with the mental health component program? I mean, are they taking that off, or what's going on?
It won't be one of the essential services covered. It doesn't mean that states can't carve out some money toward that, but
Right.
with cutting all of the other programs, the money's going to be so tight, we still won't be able to really provide adequate mental health services. So that's what Senator Kennedy spoke about, that he was appalled that they would consider cutting out mental health coverage.
Right, exactly. So what did they expect to do? I mean, how is that the mental health right now? How is that program being served? Does the federal government now, under Obamacare, are offering directly to the public, or are they giving funds to the states?
Well, they give the funds to the states, but really you have to have, even if you get a lump sum of money, typically there's line items about what you're covering with that money.
Right.
And when that's not there, now they do propose some, something they call block grants, and they propose some other, pots of money
Yeah.
for high risk patients. But unfortunately, because that's a capped amount of money, and you saw we talked about how much healthcare costs and it
Right.
continues to go up,
Right.
that's just not going to be enough money.
Right.
And
And then
it
people and the states will have to compete with that. Now you have the next slide here talk about penalizing loss of employment. Could you elaborate on this a little bit?
Right. So if you read, there's a whole policy document that I sent over to you that talks about, and this is, I didn't realize this was part of what they were proposing as well.
Right.
If you went without insurance for longer than 63 days,
Right.
you're going to be penalized when you reapply. So that means people that lost a job, say your job covered your insurance,
Right.
and you didn't have money, you were unemployed in between that time you're looking for a job, when you go to sign up again, you're going to be penalized by the insurance companies. I just don't understand why that's even written in this proposal. That
But
sounds
is
like
this now in? This is not in the. Is this now in the Obamacare plan or?
no, no, it is not. It is not.
So what is it? What is the Obamacare right now? That if you lose your job, there's Cobra, right?
There is Cobra. Now, Cobra is very expensive.
Yeah.
And plenty of people don't. I know in between jobs I've had, I've never taken Cobra. It's very expensive,
Yeah. Yeah.
but people can go without insurance, and as long as you've had insurance before and you can prove that, and insurance companies provide a document for you,
Right.
you can go and sign up for insurance, and there is no penalty. But this is creating more income again for the insurance companies.
Yeah. This is terrible. Okay. So, so you have some ideas that this worth consideration. I'm really convinced about Medicare for all, just single payer, so that every single
Yeah.
person is insured, like what Bernie Sanders had proposed. But anyway, let's talk about these ideas worth consideration that we have here.
And granted, I try to keep a balanced message.
Right.
I really am hoping that this was an opportunity for true reform.
Right.
And with that, we have to keep what works and what we know we need. Here's
Exactly.
a few things that I pulled out of that document I sent to you. Is they are now what we don't have dollars and cents behind this though, so I don't know what these items mean as
Right.
far as real money, but they are saying they will increase funding to community health. That's powerful. That's where many of our underinsured and uninsured patients receive health care.
Right.
So increasing funding to those centers will offset some of the challenges that could be created by
Yeah.
cutting Medicare.
Right.
They did say they would increase coverage options. Now, I don't know if that means the increased coverage will be affordable, but right now we know many states are down to one insurer. So there's no, competitive rates. So you
Yeah.
can't choose between one company versus another.
Right.
You have to pay whatever that one company
Right.
charges. So this could be beneficial if it's created at an affordable rate.
So now we're talking about the benefits and the challenges of Obamacare. I think the problem with Obamacare is at its inception it was already flawed, right? I mean, there was a push at one point to have the public option part of it, and then somehow I guess the administration at that point didn't think that the insurance companies would go for that. So it's a market driven type of insurance. So that's the problem that we have, and I think it's coming home to roost. I guess. I guess
Yeah, definitely. But I think no matter what, we had to do something, and I think that's the only something we could kind of move through.
right.
You're right. It had its challenges that did appear over time. In particular, I just think we don't have a way to control costs when it comes to insurance.
Right.
Just like with pharmaceuticals, we are up against a wall and pretty much at the mercy of these big companies that make a lot of money, and they're going to make a lot of money anyway. It's just
Exactly.
It's like, how much money do you need to make? They
Yeah,
just
yeah,
taken advantage of this opportunity, and unfortunately, many of our politicians have they've taken monies from these organizations, and
yeah.
it just puts us as American citizens in a bad
Exactly.
position.
Gosh, we have to move a little bit faster. This is so complicated. So now we're here. You have John Conyers Jr. talking about a
Right.
proposal, but 676. But that's one of them, right?
That's one, and I do want to say, Myrna, that Medicare in itself, like it is now, is not the answer. It would have to be adapted.
Right.
There are issues. Medicare covers seniors really well right now, which is great, and we'd
Right.
want to apply that to everyone. But the downside is, Medicare doesn't pay providers as well as it should. So it's not paying our hospitals, our doctors, our nurses, our so there's things that would need
Right.
also changing with Medicare for all, but it is a very good template for us to be following.
Well, exactly. So, like now we have 40 seconds. So anyway, so that's the presentation right there, and it's an excellent one. And Jesus, we're running out of time as usual, Beverly. So anyway, ladies and gentlemen, thank you so much, and I hope that has been educational and informative. And we will see you again next time. Thank you for the presentation, Beverly. It's an
Thank you,
excellent,
Mark.
excellent one.
Bye bye.